hear me?
Yeah, very well, yeah.
I'm sorry to be late. I mistake the start time. My name is Mariko Ueno. I'm talking from Japan. Today's my presentation is application of a pedometer for the management of impaired glucose tolerance in pregnant women.
I have no COI. Introduction. The proper management of impaired glucose tolerance, IGT, in pregnant women has a great impact on the prognosis of both the mother and the offspring and is of interest to both obstetricians and diabetologists. Although nutritional intervention along with insulin treatment is the mainstream approach of IGT treatment in pregnant women, exercise intervention is another important component of the IGT management. One explanation why the effect of exercise for glucose metabolism is controversial might be the problems with quantifying the amount of exercise. Thus, we conducted a feasible study to quantify the amount of exercise by the analysis of the data obtained with a pedometer in pregnant women with IGT. We present our perspective on the use of a pedometer in the management of IGT in pregnant women by introducing our recently published work. Today, I'm going to talk to you about metabolism during pregnancy, IGT during pregnancy, management of blood glucose level, and application of a pedometer for the management of IGT in pregnant women. First, we need to think about what will change when she has got pregnancy. Number one, maternal metabolism would change. The energy metabolism of women changes dramatically during pregnancy, and sufficient nutrition for the fetus must be provided. The fetus is nourished through the maternal-fetal interface called the placenta, by which essential nutrients, including the main fetal energy source, glucose, and oxygen, are transported from the mother to the fetus. In line, fetal waste products, such as carbon dioxide, are transported from the fetus to the mother via the placenta. To provide glucose to the fetus, various hormones raise blood glucose levels through promoting insulin resistance, such as prolactin, human placental lactogen, estradiol, and progesterone. These changes are necessary for sustained nourishment of the fetus. However, excessive insulin resistance can lead to impaired glucose tolerance. What types of IGT are there during pregnancy? Type 1 or type 2, pre-pregnant diabetes mellitus, gestational diabetes mellitus, and overt diabetes in pregnancy. Other than type 1 DM, they are caused by increased insulin resistance. IGT during pregnancy negatively impacts maternal, fetal, and neonatal outcomes. For mothers, for example, exacerbation of diabetic complications hypertensive disorders of pregnancy, and increase in the rate of cesarean section, and so on. For fetus and newborns, for example, abortion, non-reassuring fetal status, intrauterine fetal death, macrosomia, low birth weight, neonatal hypoglycemia, respiratory distress syndrome, and so on. So, maternal blood glucose levels should be properly controlled. Then, how should we control blood glucose level? Our goal is to balance energy intake and energy expenditure. Energy intake comes from meal and energy expenditure comes from exercise. First, I will talk about the energy intake. How many calories is appropriate? Before talking about caloric intake, we should think about maternal body weight and fetal growth during pregnancy. Women gain approximately 12.5 kilograms of body weight during pregnancy. This increase is due to the enlarged uterus, fetus, placenta, amniotic fluid, and enlarged breasts, etc. And they continue to grow during pregnancy. So, gaining body weight during pregnancy is physiological for the mothers. Moreover, the weight gain in thin and obese women should not be the same because of the differences in their nutritional demands during pregnancy. In Japan, target body weight gain and caloric intake during pregnancy are decided by pre-pregnant body mass index, and their proper caloric intake per day is calculated by standard body weight as the BMI becomes 22. For example, me, 154 centimeter high, standard body weight is calculated by 1.54 times 1.54 times 22, and I am the normal figure woman, times 30 and plus 200 equal 1,765 kilocalories per day is permitted. Some women with IGT try to control blood glucose level and body weight only by meal therapy, as do not eat carbs. But it is not good for her fetus because the fetal brain primarily uses glucose as an energy source. An inadequate glucose supply can affect brain growth. Our group has recently reported that in hyperemesis gravidum, in which maternal undernutrition occurs in the first trimester of pregnancy, we found that there was a correlation between the amount of weight gain from the nadir and the growth of the fetal head size, BPD, at 20 weeks of gestation. Therefore, reducing glucose intake too much to control blood glucose level and body weight may affect the development of the fetal brain. We sometimes use insulin injection to control blood glucose level for pregnant women with IGT. Externally administered insulin will help the control of maternal glucose levels, thus maintaining appropriate energy supply to the fetus. Insulin injection is beneficial for both the mother and her fetus. Next, I will talk about the energy expenditure. What mechanism can improve blood glucose control? Blood glucose is taken into the cells via GLUT4, glucose transporter type 4, and there are two pathways. One is insulin-dependent way, and the other is insulin-independent way, caused by muscle contraction. Continuous exercise causes gain of GLUT4 sensitivity to insulin and gene transcription of GLUT4. Therefore, daily continuous exercise may improve insulin resistance. However, although no pregnant patients with type 2 DM are able to increase the uptake of glucose into skeletal muscle through exercise, they experience a decrease in blood glucose level through the suppression of gluconeogenesis in the liver due to hyperinsulinemia. It is known that patients treated with insulin or hypoglycemic agents are particularly susceptible to hypoglycemia from the day of exercise to the following day. Then, IGT during pregnancy, such as GDM, which is also caused by insulin resistance. So, after exercise, does their blood glucose levels decrease same as type 2 GM? The answer is no. Even with exercise, blood glucose levels are maintained during pregnancy. Arto et al. Measured the blood glucose levels, insulin, and glucagon concentrations in women in the third trimester of normal pregnancies before and after a 15-minute treadmill exercise. The results indicated that the post-exercise blood glucose and insulin level did not change, but the glucagon level was elevated. So it is suggested that elevated glucagon level maintain the blood glucose level even after exercise. The involvement of glucagon is important to keep the blood glucose levels stable during pregnancy. Thus, sustained continuous glucose supply to the fetus is maintained. Then, what kind of exercise is suitable for her? Reference studies suggested that among all forms of exercise, walking is most appropriate for the purpose of improving insulin resistance. Observation of the types of muscle fibers that compose skeletal muscle reveals that they can be divided into slow twitch and fast twitch muscle fibers. Slow twitch fibers are suited to exercise, such as walking, that require endurance, while fast twitch fibers are more suited to instantaneous power. Slow twitch fibers are better than fast twitch fibers as shown. Therefore, exercise such as walking that utilize slow twitch muscle fibers are assumed to improve glucose metabolism. Then, how can we quantify the amount of exercise like walking? You already understand? So, it is a pedometer. This is our report. We asked pregnant women with IGT to carry the pedometer and try to objectively evaluate the amount of exercise. We used the pedometer with high-sensitivity 3D acceleration sensor, by which the recorded data of number of steps are stored chronologically for 30 consecutive days. The data stored in the pedometer and transferred through USB port of the computer and analyzed chronologically. 7 pregnant women with IGT were provided with pedometers. 3 gestational diabetes, 1 overt diabetes in pregnancy, and 3 pre-gestational diabetes type 2. This is a screenshot of the spreadsheet data imported to the computer. It shows the data, time, number of steps walked each time, and so on. Each day was divided into 3 parts defined as number of steps in the morning, number of steps in the afternoon, and number of steps at night. The timing of blood glucose sampling were pre-meal, 2 hours post-meal, and bedtime. We tried to look at the correlation between the number of steps and the blood glucose levels before and after each period. In a 24-hour time frame, we compared number of steps with blood glucose level immediately after walking. For example, number of steps in the morning with blood glucose level before lunch, or number of steps afternoon with change of blood glucose level after lunch to before dinner. However, there was no correlation between the number of steps and pre- or postprandial blood glucose level immediately after walking. Furthermore, there was no correlation between the average number of steps per day and the fasting blood glucose level on the next day. Although we did not measure glucagon concentrations, this is probably because post-exercise blood glucose levels are maintained by elevated glucagon concentrations. However, there was a negative correlation between the number of steps per day and change in hemoglobin A1C levels, change in the maternal body weight, and the total amount of insulin administered per day. So, walking a lot led the prevention of hemoglobin A1C level gain, the prevention of excessive mother's body weight gain, and the reduction of insulin requirements. We thought that these were caused by improvement in insulin resistance due to skeletal muscle contraction by daily walking. Our results indicated that pedometer monitored walking improved insulin resistance without affecting blood glucose levels just after walking and prevent excessive weight gain. In addition, Killing the pedometer may have a self-promoting effect for sustaining the exercise for the woman with IGT by noticing the improvement in the changes in the body weight and hemoglobin A1C levels in response to her steps walked. Our report was the first to show the usefulness of a pedometer for the management of IGT in pregnant women. We would like to continue our study, employing more participants along with detailed nutritional counseling. Other studies are anticipated in order to design appropriate pedometer monitored exercise plans not only for the management of IGT in pregnant women, but also for that of the obese pregnant women. Nowadays, so many kinds of application for pregnant women dealing with weight control, nutrition, fetal movement, and maternal heart rates. It would be worthwhile to develop application for incorporating pedometer data with body weight, ultrasound fetal data, and the parameters of the blood glucose control for the woman with IGT. In comparison of a smartphone pedometer with a reference pedometer, a smartphone pedometer is even superior at the low walking speed, suggesting the smartphone pedometer might be superior to pregnant women who are not expected to walk faster. So there is no problem in using the smartphone pedometer. Conclusion. A pedometer is a useful tool for objective exercise evaluation. With the widespread use of smartphones equipped with pedometer function, exercise by walking is easily monitored and utilized in both healthy pregnant women and pregnant women with obesity and IGT. Take-home message. Insulin injection supports energy intake through meals, and pedometers support energy expenditure through exercise. Then, blood glucose control of pregnant women with IGT will get better. Thank you very much for your attention. Thank you to the Diabetes 2022 Organizing Committee for inviting me. My co-workers are Dr. Koichiro Takagi and Dr. Mitze Muraoka. Dr. Takagi is my mentor and mainly involved in the study design, data analysis, and manuscript preparation. Dr. Muraoka kindly helped me in collection of data. If you have any questions, please feel free to contact me at the email address below.
Thank you.